And also raising awareness about men's health, why it's so important to get your prostate checked. Somewhere in the next 19 minutes, in other words, before this newscast is over, a man will die from prostate cancer. It just so happens that this is Prostate Cancer Awareness Month. And as part of our Health Check 12 series, tonight we take a look at one of the leading causes of cancer death in men. The numbers are staggering.
Well, 1 in 6 American men will be diagnosed with prostate cancer in their lifetime.
And in the next 19 minutes, somewhere a man will die from it.
Still about 30,000 American men die of prostate cancer every year. And with that, it becomes the second leading cause of cancer death in men, behind lung cancer.
The good news is, with early detection, prostate cancer is extremely treatable, even curable, with surgery, radiation, or cryotherapy, which is freezing the cancerous tissue.
There are no magic bullets yet. There are no pills or drugs that we take to eradicate prostate cancer, but there are a lot of new drugs and new treatments that are out which can control or put people into remission, oftentimes for years or decades.
And Dr. Larry Bands, a board-certified prostate cancer specialist, knows firsthand about that heart-stopping moment when a man is told that he has it. Fortunately, he saw the warning signs.
And I went into my office one day and I said to one of my partners, "Why don't you biopsy my prostate after hours today?" And he looked at me in amazement. He said, "You've got to be kidding me." And I said, "No, I've been tracking this. I've watched it for about 9 months. I'm concerned, enough to go ahead and go through a biopsy." And we did it. And I was found to have an intermediate grade cancer, which was fairly aggressive. I was surprised, there's no doubt, but I'm very fortunate that it was picked up early, and I decided to treat it aggressively, and here I am today.
But once again, the key is early detection. Guys, if you're in your mid-40s, and especially if you have a family history, get your prostate and your PSA levels checked. And if your primary care doctor won't do it,
if the primary care doctors are not doing it, I think a man needs to take hold of his destiny and consider going to a urologist or someone who will check them for prostate cancer.
So here's to more survivors and to men taking charge of their health. And you can get more information about all of our Health Check topics and stories by visiting 12news.com and click on the Health Check 12 tab.